I think the beauty of real time is the fact that we provide a continuous radiology presence and service to our clients, which really in turn leads to improved patient care and turnaround times. There's some clients that we have that do not have an on-site radiologist, so we do provide coverage around the clock for them, but we do have a lot of other clients where they cover the daytime hours and then we provide their after hours services. The reality is, if you're dealing with outpatient work, you can probably get by without having an on-site presence a lot easier than it would be when you're dealing with emergency and inpatients. So the nice thing for the ER docs and as well as the referring clinicians elsewhere in the hospital is they have access to the system. So they're able to monitor the status of their patient's studies. They can determine which radiologist it's assigned to, the reporting status of it. So if they know that they've got the case assigned to me and they want to talk to me and discuss maybe the findings or concerns about it, they can reach out to me directly. I end up having a first name basis, quite actually a decent relationship with a lot of the referring clinicians, both in the emerge department and on some of the inpatient physicians as well. It's actually quite unique. Consistency, I think, actually helps both of us. We kind of know who we're working with. It ends up being a bit more of a team-like atmosphere. So a lot of the emerge docs actually work similar overnight shifts to I do. So there is that kind of better rapport, I think, that helps all of us. The software is actually very, very user-friendly. It took me no time at all to get up to speed. The software actually enables its radiologists to easily report for and support multiple sites. So it generates, when I work, it generates me my own work list based on my skill set. And then there's other radiologists on at the same time. So one of the unique features of real-time software is the fact that it actually workload balances automatically across all available reporting radiologists. So this really helps us both manage our work lists and report cases in a timely fashion. It affords me the necessary time to both thoroughly review it and report it properly. And on the flip side, if I'm all caught up on my work list, I'm available to help others if need be. So the work kind of gets shifted around depending on who's available and, to help reports. I myself have always loved the practice of radiology, but I've often found myself struggling with how I've had to practice it. And that's the one thing that I can say about real time. It's actually finally, enabled me the ability to practice in a way that works best for me. And to be honest with you, I couldn't be happier with my decision. It's afforded me the autonomy, the control, and the flexibility that I had lost in my prior radiology practices.